I'm Bruce Steinberg at the Jacksonville Orthopedic Institute. I'm an orthopedic surgeon and chairman of the board. So telemedicine is one of the things we're doing. We're offering for patients to call into a Zoom program, so we have the ability to video, see them, and hear them. In a follow-up patient, one of which we have already seen, it really works well because if we had a test done, we can actually even show them the test, the MRI result, point out what we're seeing, go over the test. A new patient's a little bit more difficult. We get an introduction to the patient, we understand what their problem is, but we can't do that physical exam. On the follow-up, if they had a test, we've already done the exam. So then we put the two together. We're seeing both new patients and follow-ups this way. The new patients, people who are at risk, so those 65 and above, or coming from a distance, it really has opened up a whole new area of what we can do. And now that it's been approved through insurances and Medicare, today met a patient who's in Tallahassee. So that patient in Tallahassee didn't have to make the trip to see me to get an initial evaluation to see, can I help that person? So that will actually broaden our footprint from that perspective. And more importantly, right now in this pandemic, it allows us to keep those people out of the office and limit their exposure. But there's a limit, and that's that examination. And while it's low tech, when it comes to orthopedics, it's so important in making the diagnosis and the treatment plan to follow.
Ehren Allen, I'm a physical therapist here at the Jacksonville Orthopedic Institute. Back when the COVID-19 crisis first came about, we had to make some quick changes here at JOI so that we could continue to see our patients who were concerned about contracting that illness. One of the ways we've done that is to initiate telehealth visits. We're doing that with our physicians and with our therapists so that our patients can continue to be seen even if they can't come into our offices. So some of our athletes have chosen to do telehealth visits instead of coming into the office. We have some who still come into the office at times, but may do a telehealth visit if per se they can't make it into the office that day, or if there are a higher volume of people that day and they have concerns, they can still do a telehealth visit from home.